Vitamin D deficiency. Let's start. To know the etiopathogenesis and clinical finding in vitamin D deficiency. To understand etiopathogenesis, clinical findings, treatment of osteomalacia and rickets in animals. Rickets in cows, osteomalacia in adults. Complex interrelationship between the mineral calcium, phosphorus, vitamin A and vitamin D cause severe loss of productivity. Vitamin D or its precursor enter the body by three routes. By solar radiation, vitamin D can added to the milk or in milk replacement fed for calves in concentrate for adult cattle. Lack of ultraviolet irradiation is the important cause of vitamin D deficiency. Signs. Clinically, the important effect of vitamin D deficiency is defective growth and mineralization of bones. Non-specific signs include poor productivity, stunted growth, and lameness. The joints enlarge and the growth plate thickens with uncalcified cartilage. A disease of growing animals, disease of mans, apex, birds, rats, neighboring swine not in domestic animal in West Germany, but rickets in dog and cats. Clinical cases have not been described. Rickets in dog is due to miscellaneous group of calcium and phosphorus deficiency, hereditary bone and cartilaginous skeletal deformities due to the other disease like distemper. Absorption of calcium may be low in spite high calcium intake of vitamin D is not there. Vitamin D requirements influenced by calcium and phosphorus ratio. Rickets in due to failure of calcium salts to be deposited promptly in the new form. Defective endochondral mineralization of the bone, joint, or provisional calcification of the long bones. Causes. Inadequate supply of calcium and or phosphorus and or vitamin D. For mineralization, osteoid requires 10 ml of calcium ionized phosphorus or Hp04 in blood. Low calcium absorption due to gastroenteritis, lack of vitamin D, formation of insoluble calcium salt. Clinical signs: gastric disorder, bronchitis, generalized tenderness, restlessness, emaciation, tiredness in puppies, occasional convulsions or tetany. Walking in brisk than toys due to weakness of flexor tendon. Recombinant failure to grow. Bone, bowing of legs, tendon on ribs, rickety, rosary. It's also known as rickety rosary. Body is too heavy to legs. Epiphyses of long bones are swollen. Long bones bend metacarpus, thin and crouching growth. Ribs bended inwards, so on both the side of thorax there is longitudinal shallow grooves. Pelvis, acetabulum is pressed upward and inward by head of femur, so contraction of pelvis. Vertebra, various deformities, why it is called ricketies. Lateral, scoliosis upward, kyphosis downward, lordosis. Second and third antagonistic curves. Skull, thickening and deformities of rami of inferior maxillary region, difficulty in respiration, asphyxia as a facial bone bulges. Differential diagnosis: distemper, nasal and ocular discharge only gastric intestine. Chorea is mosey order problems and bronchitis, muscular rheumatismus, no enlargement, tumor individual bones. Treatment: ration, calcium 1.2% with vitamin D supplements, phosphorus 0.8%. Add 0.5 gram calcium carbonate for every 100 gram of meat feed. Feed with organic meat like liver, kidney, heart. Give cod liver oil, better halibut liver oil. Cortisone and calcium supplements. Avoid continuous yeast or liquid paraffin. Thank